This episode is part 2 in our 4-part series on how to recognize and properly address when clients object to going through the treatment process and make excuses for why they can't commit to getting their problem fixed. In the episode, I cover the following: the huge shift that occurred in my practice when I changed my relationship with money, understanding the difference between price and value, how can pricing too low hurt your business, how to avoid price demons and discount seekers, how to address price concerns or hesitations to sign up for treatment. I hope you learned something new from the show that you can implement immediately in your practice. Welcome back to the Soft Tissue Treatment Revolution podcast, where we teach overworked manual therapists a new injury treatment system that eliminates the frustrations of not getting consistent results, allowing them to cut their treatment times by at least 50% and easily double their income. If you're new to the show and you have no idea as to who I am, my name is Dr. Matt Maggio, and I got my degree in chiropractic well over 15 years ago, but I've never performed an adjustment in practice, and I focus my treatments solely on doing quality soft tissue based work. And I believe that the best and safest treatments in the world to fix injuries and help people get out of pain are soft tissue treatments delivered by world-class manual therapists. Thanks so much for stopping by and checking out the show. All right, so just a quick reminder, this is a 4-part series. So if you haven't listened to part 1, I would definitely encourage you to go back and listen to that first to get the most out of the episode and kind of get the concepts and foundations. But first off is a huge shift occurred in my practice when I changed my relationships with money. You know, we hear this all the time, money is the root of all evil. I don't need money. It's okay. It's bad. People that have money is bad. But I started to realize, probably about 10 years ago that all really money is just an exchange of energy. Basically people work for their money for energy, and then they use that money to purchase other things. That's all it is. There's no feelings behind it. There's no emotions behind it. It's just it's a way to exchange things. And if you're giving value and someone wants to buy it, then it's something you should be totally comfortable with. Another thing I realized too was when I'm presenting the options for my treatments and the price, I really needed to treat everyone exactly the same way, with no biases. As humans, we're built with a lot of these innate and deep biases where we kind of judge someone. Maybe they came in a crappy car, maybe their clothes are a little dirty, maybe they're a little hectic or chaotic. And then, that would change it a little bit. And then I found myself not, presenting them exactly how they needed to, because I already made a preconceived notion that they weren't going to buy based just off how they look. And I know that's really lousy to do that as a human, but we all do it. But recognizing it and catching it before it becomes a problem is really, really key. And it's helped me a lot. I've had other clients that rolled in a $100,000 car, and I'm like, oh, this is going to be a lay down sale. And I didn't give them my best, and they said no. And then I've had other people where they worked at a fast food restaurant, but I presented and treated them exactly like every other person, and they realized the value of it and they invested in the care. Another thing that really helped change my perspective too is don't sell from your own wallet. A lot of people are like, well, what does that mean? It's the concept of it might seem expensive to you, but it might not seem expensive to another person. Everybody's different. So continue to treat everybody the same. Don't have those biases, and understand, like I said, money isn't the root of all evil. The love of money is the root of all evil, but money gets you freedom, gets you the chance to have a better life for yourself, for your family, everyone around there. And, I see so many manual therapy providers having this false, I don't even know what it is, justification or, some type of idea that they're more righteous because they don't charge as much and they want to make it affordable for everybody. Next thing is understanding the difference between price and value. I always tell people, and I say to myself, price is what you pay, value is what you get. My biggest rule that I have as I'm going through my process is we don't go over the price until I know I can help you and the client knows the value I can provide. I've talked about this in past episodes, but it's really why I don't put any pricing on my website. And I really encourage other providers not to do that as well, because what happens is they really just start to shop you on price. You get stuck in what I call that commodity trap, where they're just kind of like comparing you to other people in your area that do the exact same thing. They don't really know the value. So we don't go over price until I know I can help you first, and then you know what kind of value I can bring. Next part is how pricing too low can hurt your business. Here's the truth. You're never going to compete on price, and you're always going to lose out to the big chains, the massage envies, the Hand and Stone, if you're in the chiropractic world, the Joint, insurance model physical therapy. You're always going to lose out because they're able to have the margins and the things to charge less because they see more people. And you're always going to be stuck doing more work and making less money. Here's another thing that I also learned is the people that pay more money, they're more invested in the care and they take it more serious. About year 5 into practice, I tried this radical idea of I called it like a case fee, where clients paid me like anywhere between $3,000 to $5,000 upfront for all their treatment. And I switched away from like the pay-as-you-go model, where clients were paying anywhere from like $75 to $100 a visit. And you know what? The clients that paid more, they were more compliant. They took it seriously. They got their problem fixed, and they were way less of a pain in the butt. So I realized that people that pay more, they value the care more and they take it more serious. Another thing that I learned with pricing and when you sell something is you do want to get a little bit of a gasp, or like when you present the price, you want to be like, whew, that is expensive. And I want that gasp to be there, because if they, like I said, if they think you're too low, they're not going to take you seriously. Now, if you don't have the skills to offer that and you just randomly offer that, like, you're going to get exposed. But if you're putting the time in, you have true value, and you're one of the people that can actually solve a problem for people, that gasp is going to be really, really important. And when the pricing is high, like I said, it gets them to invest in the process when their pain is actually the highest and they're the most excited to get it fixed. This is why I teach selling all of the treatment in the process up front on that first visit, instead of like pay as you go, because as they start to feel a little bit better, they're not as serious. When they're really serious and they've been dealing with it for a long time, they're in pain and they want to get to where they need to go. Remember, I forgot to preface this. I'm always talking to manual therapists that want to treat people in chronic pain. I'm not talking about relaxation or recovery. That stuff's fine if you want to do this, but I'm talking to people that want to help people in chronic pain. And when they're in chronic pain and you can explain to them exactly what's going on and how you can help, you sell it to them in the beginning, because that's when you're going to get the best buy-in, the best investment, and they're going to commit to the process. Next one is how to avoid what I call price demons and discount seekers. These people are the worst. I call a price demon is a person that's always looking for a deal. They're never loyal, and they tend to like hang out with other people that are the same way. I've talked about this in past podcasts, but the idea is like you never offer a discount for what you do. You can offer other incentives or other bonuses, but never offer a discount for what you do, because first off, the client devalues it, and then you devalue yourself. So I want to dive in a little bit more about why discounts are bad and why you should never take them. As I said just a few seconds ago, it devalues the care and the clients don't take it as serious. Then you also get stuck in, here's the thing. I see this all the time where, especially manual therapists, more massage than anything, is like the longer the treatments you buy, like say you do a 60, but then you go to a 90, and then maybe you go to like 2 hours, you start giving them a discount for the longer treatment they do. Here's the thing though, you're not selling an actual product, like a physical product, but you're actually selling yourself. And that makes more wear and tear on your body, because it's such a problem as you do that, because you're still having to provide more care, more wear and tear. And like, it looks good on your schedule because you're like, oh, I got 3 90-minute massages today, or 3 90-minute treatments. But a lot of times people are discounting that like anywhere from like 15 or 20%. So you're actually losing money throughout the day when you do that. I made a whole in-depth episode on the podcast, and I talked about the idea of what to do instead of discounts, and really just adding something extra that doesn't put more wear on you. In my clinic, I do this thing called a postural transformation program, where we show them things they can do from home, some breathing, hydration, movement, and stuff like that, where it gives the client a lot of value, but it's not taking the wear and tear on you as the provider. So lastly, probably the most important, how to address price concerns or hesitations to signing up for treatment. I'm going to give a little bit of a context here and how I teach it. This could either be when they first reach out and you're qualifying them, or during the consultation. So I always continue to talk about this idea that my system called the PEAK method isn't just some treatment or technique. It's actually a system from start to finish. Teaches you the right questions to ask, going through the process across the board. I talk about this idea of like qualifying them. Usually what I want to see in my clinic is that they have a specific problem that I solve. They've been dealing with it for at least 6 months, and they've seen a few other providers. That lets me know that they're in chronic pain. They've taken some action and they're ready to get some actual results for that. So continuing to get that. So, you get people that come in right away and they're like, hey, how much does this cost? And remember my rule, always stick to your rule. We do not go over price until I know I can help you and the value I can provide. I don't say it like that directly, but that's what I'm saying in my mind when you're just like wanting to tell them right away. Because if the price is there before you ever know, they're just going to judge you solely off price. So they say, hey, how much does this cost? This is how I would do it. I say, hey, you know what? Great question. And I'm glad you asked. And then I get into my spiel. And I say, since what I do here in my office is so unique and specialized, and I do have a high success rate with my clients, but that's only because I properly screen any potential clients and only take on those I know I can truly help. So if you're willing to answer these questions and I'm confident that I'm going to be able to help fix your problem, then I will gladly go over all the cost related questions. Does that sound good? So I'm being reasonable. I'm being fair. I'm not being a jerk yet. And most people will be like, you know what, that does sound reasonable. I'm looking, to get actual solution for my problem, unless they're one of those price demons, and then you just want to wash them out right away. And usually that'll wash them out right away because you do not want to deal with those people in any capacity whatsoever. Then say they do push again and they say, oh, I'm on a budget. I'm just trying to figure it out. And I say, you know what? Once again, I totally hear what you're saying. Here's the thing though. I haven't even had a chance to properly assess you to even know if I can help. And in all honesty, anyone that just gives you a price over the phone before they ever know if they can help is never going to be able to fix your problem. And I would definitely avoid those people at all costs. One thing that I can assure you though, is the treatments that I do in my office, they're not cheap because they actually work, but they're not overly expensive either. And I do work with people on all budgets once I know for sure that I'm going to be able to help. So if you are ready to answer these questions and I'm confident I'm going to be able to help, then I will gladly go over all the cost related questions. And if they still push at this point, you got to get away from these people. You don't want to deal with them. I understand that. You're like, I need this client. I need this money. I have to pay my bills. I need them. But these people are going to be the biggest pain in the butt in the entire world. People that are reasonable, looking for solutions, will follow your process. You're the leader. You're in control. The client isn't calling the shots. And if you automatically default like, yeah, it's going to be 150 and this is what it is, you lost everything. Now the client is in control. They're going to judge you based off price. More than likely, they're not going to come in because they're either going to think you're too expensive for what you do, or you're too cheap. They're probably going to think you're too expensive because someone down the street is charging differently, but they don't know the value that you can provide. And you just really put yourself in a bad position. But even worse, that client had a chance to get a solution from you and you blew it because you didn't follow the rules. That's all I got in this episode. I hope it is helpful. So many manual therapists out there, they struggle with like the business and the sales side of things, but it's so important. If you have an amazing product that can truly help someone, you got a duty and obligation to sell your butt off. So be sure to check out the next episode in the series where I'm going to go over the process of how to properly address and handle I need to ask permission or talk to someone else before I can make a decision. This is very common as well. They say, I'm not the decision maker. I need to talk to my wife, my husband, my partner. They don't want to make the decision. Really, they're just telling you that they don't trust that you can help. But this is really important to recognize that one as well.